Greetings all. I'm Jeremy Hess. I'm an emergency physician, professor, and director of the Center for Health and the Global Environment at the University of Washington. I'm also an author on the Global Report and have had the privilege of serving as the senior author on the US brief since 2018. I'm very pleased to introduce Dr. John Balbus, a longtime colleague and friend. Dr. Balbus will be delivering our closing keynote. He's the acting director of the Office of Climate Change and Health Equity at the Department of Health and Human Services. Dr. Balbus is a physician, a scientist, and a member of the National Academy of Medicine. He served as the senior advisor for public health at the National Institute for Environmental Health Sciences and as chief health scientist for the Environmental Defense Fund. He's been a long champion for climate action and health equity, and I'm looking forward to his perspective. Dr. Balbus, over to you.
Well, thank you so much, Jeremy, for the kind introduction, and thank you to the organizers of the event today for inviting me to speak here today, and especially to the whole team that produced the Lancet Countdown and the U.S. Policy Brief for your incredibly important work, combining numbers and narrative, as you've done so well in this event, to describe the intricate relationships between climate change and public health. I'm honored to represent the Department of Health and Human Services today and want to be sure to convey the regrets of Secretary Becerra and Assistant Secretary for Health, Admiral Rachel Levine, who would be here if they could have been. The report you're launching today is critically important and profoundly underscores the urgency of our the climate change response in public health and healthcare. And as the COVID pandemic has laid bare, climate change isn't happening in a vacuum. The ways in which it threatens our health interact with existing inequities to place the heaviest burden on those already suffering from degraded environments and health disparities. And we've seen this summer this all play out in real life. I'm sure for most of you, Hurricane Ian, third deadliest hurricane with incredibly rapid strengthening over the Gulf as climate change is leading to with our Gulf hurricanes. 16 hospitals taken out of commission, 1,000 people having to be evacuated. And that's just one of the climate-related weather extremes we've seen, the heat waves in California, the flooding in Kentucky, the devastating wildfire and smoke in the western United States. So this is real, it's happening now, and we have action that has to happen now. Our mission at the Department of Health and Human Services to enhance the health and well-being of all Americans cannot be met without addressing climate change. We're working hard to achieve our vision where everyone, especially those most vulnerable, is protected from the health impacts of climate change. And for us, it also means a health sector that is prepared to operate in the midst of increased climate-related health threats, and also that has drastically reduced its own greenhouse gas emissions in line with the Biden administration's economy-wide goals of 50% by 2030 and net zero by 2050. We understand this vision will require resources, and that this is extremely difficult for a sector that is already struggling to respond to the pandemic. And we've heard this straight from the health systems and suppliers who've responded to the 6 climate-related requests for information that HHS has published this year. But in order to protect not only future generations, but all of us relying on healthcare in the United States right now, the sector needs to adapt. This has been driven home time and again as extreme weather events have stressed hospitals already struggling to cope with the COVID pandemic. And in addition, healthcare contributes about 8.5% to overall US carbon emissions. So the fundamental motto in medicine, above all do no harm, means not only preparing for the effects of climate change on health, but also that we must stop contributing to the problem. And we've made some good progress this year on this front. To start, we joined the COP26 health program, committed to building climate resilience in our health systems and decarbonizing our health systems. Our office has been working very closely with federal health systems like the Veterans Health Administration, the Defense Health Agency, the Indian Health Service, and others to meet these goals and to help to implement Executive Order 14057, which calls for the federal government to meet all of the greenhouse gas reduction goals. And through the White House and HHS Health Sector Climate Pledge, we've also invited private sector leaders to join federal health systems on this journey. And we're continuing to roll out new supports and information on accessing federal assistance to help these private sector partners. As an office at the federal level, though, we recognize that most of the action on climate resilience has to happen at the state and especially the local level. And so we've been working very closely with our regional offices to hold climate change and health equity summits, to raise and listen to the voices of communities in the regions that are being hardest hit by climate change impacts, and to enhance the coordination of federal resources to address these local needs. HHS has been working directly with states and cities for years through the CDC's Climate Ready Cities and States initiative, and more recently through Medicaid agreements, like a recent agreement with the state of Oregon that allows states to introduce innovative actions to address climate threats to their population with Medicaid funding. Of course, the LIHEAP, the Low Income Home Energy Assistance Program, has expanded greatly with congressional support in the last year to implement cooling programs across the country too. In our office, the Office of Climate Change and Health Equity is playing a unique and important role within the federal government, using our convening powers and technical assistance to support all of HHS in developing a robust climate adaptation and resilience plan and bringing together the suite of federal resources across the agencies available to support the public health and healthcare delivery systems in addressing the climate crisis. For example, this year we've launched the Climate and Health Outlook. I hope everybody has had a chance to see this. It's a novel product that not only includes a seasonal forecast for health, interpreting the 30 and 90-day forecast for temperature, precipitation, and the government's forecast for drought, hurricanes, and wildfires from a health standpoint, but it also identifies and puts numbers to the people most vulnerable to these impacts in the areas that are being affected, and catalogs the various federal resources that are available to help these people stay safe. We're also in the midst of a webinar series describing federal resources available to the health sector to achieve decarbonization and enhance climate resilience, and we'll be working across HHS and other federal agencies to develop and disseminate revised guidance on health sector resilience and decarbonization. And we're planning additional outreach and events to help raise awareness and build capacity for action across the healthcare and public health sectors. This will, of course, include ongoing resources related to the Inflation Reduction Act. While the Inflation Reduction Act has no funding for climate change going to the Department of Health and Human Services, there are tax credits, technical assistance and tools, and it's creating remarkable opportunities for health stakeholders to become more energy efficient and well prepared. And our office is helping to raise the word on this and make the health sector aware of these resources. So I hope you'll agree we're making great progress, and yet the urgency of the situation means we still have much more to do to place health at the center of conversations about climate change, as Administrator McCarthy, as Marina in the beginning so articulately laid out. As we go to the COP, health, there's no health day at the COP. Health still needs to be elevated as not just something that people talk about, but something that the mainstream climate committee acts on and helps the health sector to at the same way that it's helping other sectors. And also to mobilize the resources and the will to assure that communities are protected and the health sector is adequately supported in its necessary efforts to adapt to the growing challenges posed by climate change. So let me close there. Again, express my appreciation for your important work and our offices, and in fact, all of the Department of Health and Human Services readiness to continue to collaborate with you. Thank you all for your time today.